Here it is, at long last, our last mini lecture for this chapter. I'm so grateful. I don't know, this chapter has felt really long to me. Okay, so we've now talked about the brain anatomy and its functions. We have talked about, without being specific, around how does the brain actually communicate with the rest of the body. So we know that we get input and output to and from the brain. That is going to happen through these cranial nerves. Cranial nerves are going to arise at the base of the brain, and they're going to exit the cranium through our foramina, or holes in the cranium, and they're going to go to the body and back. I am going to keep this lecture very short. I'm going to name our 12 different pairs of cranial nerves, and then I'm going to send you off to complete your understanding of it. So much of this piece is going to be done on your own, because I'm not asking you to know a lot. I'm asking you to know the 12 pairs. I'm asking you to know whether they're motor or sensory nerves or both, and then a general idea of what organs they are going to send or receive information from. All right, so here is a very quick look at the cranial nerves. Again, this is for brain to body and body to brain communication. We have 12 pairs. They can be defined as sensory nerves. So sensory nerves would be nerves that only bring sensory information from the organ to the brain. They may be motor, which means that they are going to carry information from the brain to an organ that's going to cause a contraction or response of a gland. Or they may be mixed. So mixed would mean that they have both sensory and motor function. So our traditional way of looking at it is we have sensory nerves. So in the brain, sensory nerve pairs would be 1, 2, and 8. Motor would be 3, 4, 6, 11, and 12. And then mixed would be 5, 7, 9, and 10. Now, the reality is that only 2 of these nerves are going to be completely sensory, and that's going to be 1 and 2, and the rest of them are going to be mixed. So this is the traditional way to lay it out. The reality, again, is that most of them are mixed and that only 2 of them are purely sensory. I just want to throw that out there so that you're aware of it. Depending on what book or what resource you're using, they may define sensory, motor, and mixed differently. I've now sort of given you both of those pieces. You can sort of fill in the rest. Okay, so what I'm going to do is actually, on this slide, I'm going to just name our 12 pairs, and then on the next slide, I'll give you a touch more information about where they're going. But we do name them in order. So we have the olfactory nerve, which is 1. We have the optic nerve, which is 2. The ocular motor nerve is 3. Trochlear is 4. Trigeminal is 5. Abducens is 6. Facial is 7. Vestibulocochlear is 8. Glossopharyngeal is 9. Vagus is 10. Accessory is 11. And hypoglossal is 12. So if you don't know your Roman numerals, you may have to become familiar. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. So you can see where in the brain we're looking. This is a inferior view of the brain, so we're looking up underneath it. So here's our, this would be the medulla, there's the pons, there's going to be our midbrain tucked in there, cerebrum, cerebellum. And you can see where these nerves come off. So let's go to the next slide and just quickly define what regions these nerves are going to. And so this slide also shows sensory versus motor. And so you can see sensory is shown in green and motor is shown in red. So, this is a little bit confused. So this would be 1. So 1 is going to be our olfactory nerve. It is only sensory, so it's only carrying information from the cribriform palate or from this olfactory plate into the brain. so that's going to be sensory. We have optic, which is 2. Optic, again, is purely sensory. It is coming from the eye, so it is involved in vision or understanding what we're seeing around us. Our ocular motor is predominantly motor. It says it in the name. Again, there are some sensory fibers in there, but predominantly motor. And so it is going to be involved. So here's 3. It's going to be involved in eye movement as well as movement of the eyelid and the pupil. We have 4. 4 is trochlear, again, predominantly motor, involved in eye movement. We also have 5. 5 is going to be our trigeminal, and it's called tri because it's divided into 3 different branches. So you can see here's 5-1, 5-2, and 5-3. They are going to be both sensory and motor, primarily involved in movement of facial muscles. Sorry, this is in a different order than how I have them listed, so I'm making sure I had everything on here. So here is going to be abducens, again, eye movement, primarily motor. 7 is going to be our facial nerve, so it is going to be involved in facial muscles. It has quite a few branches as well as taste buds, so an ability to taste comes from that, and it is motor and sensory. And then we have 8, which is our vestibulocochlear, hearing and equilibrium. It's going to be motor and sensory. Glossopharyngeal, sensation of the tongue, throat, and ear, as well as, interestingly enough, some cardiovascular and respiratory functions. So we're starting to branch sort of beyond the immediate sort of facial area and down to the rest of the body. The vagus nerve, I feel like I missed one. No, I didn't. Okay, the vagus nerve is cardiac, pulmonary, digestive, urinary functions, so a lot of visceral functions here, and it composes about 90% of our parasympathetic fibers. So most of our parasympathetic nervous system actions are going to come down through the vagus nerve. We have the accessory nerve, which is swallowing as well as neck and shoulder muscle movements, and then hypoglossal, which is going to go to our tongue. Okay, so that is actually all I'm going to give you. Again, I don't expect you to know all of the branches and all of the components, but just the general idea of what the cranial nerves are, whether they're sensory, motor, or mixed, and what their primary actions are going to be. And with that, we are wrapping up chapter whatever this is, 13-ish. Okay, so we will come back next week and go through chapter 14, which focuses on the spinal cord and somatic reflexes. Hooray!